this video is for week 10 wellness. We're doing 4 cervicals and 3 shoulder movements to increase range of motion, mobility, stuff like that. First and foremost, before any of these, just want to imply that I would be asking my patient if they have any neck, wrist, knee, shoulder, elbow injuries, anything that would limit them from doing these movements. Hush. All right. First off, we're going to start with the 4 cervical. We have A to P glides. So I'm going to stand sideways so we can kind of see here. I want to keep the chin nice and level. And then anterior and posterior gliding. We are focusing mainly on the posterior. So we want to make sure that we're squeezing this back, holding for 3 to 5 seconds. And we can do multiples of those multiple times a day. It's good to keep a ball in your glove box and kind of do that and press the ball back against the headrest during red lights and things like that. Next we have lateral glide. This one's pretty difficult to do. Just kind of have to really learn how to stabilize and focus on each muscle. We want to really focus on the flexors and extensors here, keeping the body nice and still. We're bringing the head laterally. So as you can see, we're keeping the body nice and still. Just trying to focus on the lateral flexion here. You can raise your arms up to kind of make it a little bit easier for you to do. Okay, next is 45-degree forward flexion. So I'm going to take my head and look down at this pec here and take this hand and really pull down. Get a nice stretch here in the traps. And we'll switch sides. And you can keep alternating there. Make sure we're looking at that 45 degree at each pec. Last for the cervicals is going to be horseshoe circles. Same as the last one, we're going to start looking at this pec here, but then we're going to slowly bring the head all the way back around. So we're looking at the opposite pec. We're going to do the same thing, opposite direction. Bring it back nice and slow. Thank you. Good. Alright, so for the next, we got 3 shoulder movements here. First one is the shoulder socket drill. This one we're going to make sure that we're making those fingertips rise nice and high in the sky. And we're going to pull down and in here on the shoulder blades again. You can see here, we want to make sure our scapulars are basically touching. This is that closed pack position. This is the most stable. My fingertips right now and my elbows are starting to feel a little numb and tingly, and that's perfectly normal. I'm going to hold this for about 30 seconds as long as you can. Start to feel some fatigue. This is good for extension here. Okay. The next one is going to be shoulder rolls. We're going to get on. You can do this in a few different positions. I'm going to go ahead and demonstrate it on all fours. We're going to make sure our fingers are spread nice and wide. We're going to lock out the elbows here. We're going to go ahead and we're making sure that we're moving the chest and the thoracics. Alright, I want to make sure that we're coming down and touching those shoulder blades together and then bringing them back up. This is not cat-cow. We are just incorporating here. After we get this movement down, I'm going to start incorporating some circles. And then once we get that down, we'll go opposite direction. It's a little more difficult here. Like so. I'm going to make sure you're getting that scapular retraction there. And then last but not least, we have swimming circles. So this one we are going to just be scooping. You can alternate, or you can do all on one side. And this is a good indicator, watching people to see where they have instability or lack of range of motion in the shoulder. Okay, just backstroke, no forward stroke. And that is it.